So there's not many elective conditions that affect the elbow. You can sometimes get some arthritis. You can get problems with tendons around the elbow, tennis elbow, golfer's elbow. Most interesting part about elbows is the trauma and the multitude of injuries that can happen to an elbow. So it's lots of different injuries, most often from trauma, blunt trauma, falling. It's fractures and dislocations of the elbow, which are the most common problems that I face. So for me, the treatment of an elbow is to make sure that it's stable and safe to move. Everything I do is I want to get this elbow moving as quickly as it can. Sometimes you can't get it moving. Sometimes you do need to mobilize it. But whether you go operative or non-operative, I'm always trying to get that elbow moving as quickly as it can. Because once it gets stiff, it's very difficult to get the stiffness out. Now, not all elbows need an operation. Sometimes they just need some physiotherapy. Sometimes they just need some guidance on what to do, or maybe a little bit of time for it to heal. When surgery is indicated, then I do think that you need to be a little bit aggressive with the surgery so that you fix it, replace it, repair the soft tissues so that you can get it moving. The expected outcomes for an elbow. So one of the problems with elbows is they get stiff very, very quickly. Sadly, I'm sorry, if you've had a fracture dislocation of your elbow, you're never going to have a normal elbow. But I'd hope every patient to get a functional range of movement. That's from about 30 to 130, supination of about 50, pronation of about 50%. And most people should get a functional elbow from an injured elbow. Sadly, movement will be never normal, but often they'll get a functional use. So the first step is assessing the injury. So examining the patient, listening to the patient, listening to how the injury happened, and then a careful analysis of the imaging, whether that's plain films or CT scan or MRI scan, getting an idea of how much force has gone through that elbow, and then having an appropriate treatment plan that you can then stabilize the elbow if it needs stabilization so that you can get it moving. So one of the, when I first started treating elbows, if you see a really bad elbow injury, your tendency is just to bury your head in the sand, I just don't want to be here. Maybe this will get better if I put it into a cast or a back slab. I strongly believe that movement is what brings an elbow the function. And so if you can, fix it, replace it, or stabilize it so that you can get it moving.